Okay, let's dive into the sources you've shared with us for this deep dive. We're looking at something with very real-world impact today. AI helping doctors write patient notes faster.
That's right. And specifically, the focus seems to be on voice-to-text tech and automated documentation.
Yeah, this hits on a really familiar challenge, I think, for anyone who knows healthcare. The administrative burden.
Oh, absolutely. Your sources really hammer this home.
Yeah.
Doctors, nurses, they spend so much time, not with patients, but, documenting hours of it.
Right, just documenting the encounters. And doing it manually, well, it's slow.
Slow, and it can lead to mistakes, right? Especially when you're rushed. Even the older dictation methods weren't always smooth sailing. A bit clunky sometimes.
So this is where the sources say AI comes in, this AI-powered voice-to-text thing.
Exactly. It's presented as a potentially much more efficient way, maybe more intuitive too, for handling all that paperwork.
Okay, so the mission for us here is to unpack what your sources actually say about how this works, on the ground. What's the impact they're reporting, and what makes it work well?
Well, the way the sources describe it actually happening in, a clinic setting is quite interesting.
How so?
They talk about integrating it right into the workflow, so maybe during the consultation or right after.
The doctor just talks.
Pretty much.
Yeah.
Speaks into a mic, maybe some kind of voice device, just talks through their observations, their plans.
Okay.
And this is where the AI gets, clever.
Mm-hmm.
The sources explain there's this powerful AI engine behind it all.
An engine, right.
And a really crucial part of that engine is something called natural language processing, NLP.
NLP. Okay, I've heard of that. What's its job here? What does it do?
So the NLP is kind of the understanding part. It's not just turning sound into text, like basic transcription.
Okay.
It helps the AI figure out the meaning, the
Right.
context, especially with all the medical jargon and, the shorthand doctors use.
Right, they have their own language sometimes.
They really do. So NLP helps pull out the important bits needed for the actual note.
So the AI engine handles the typing, basically the transcription, and the NLP makes sure it understands what it's typing, medically speaking.
That's a good way to think about it. The AI transcribes it often, like right away, real time, and puts it straight into the patient's electronic medical record, the EMR.
But wait, the doctor doesn't just dictate and walk away. They check it, right?
Oh, absolutely. The sources are very clear on this. It's crucial. The system spits out the text, maybe even a first draft of the note.
In there.
And then the doctor or the nurse, they review it. They have to review it, make edits, add things, clarify anything, make sure it's totally accurate before they sign off.
So it's helping them, augmenting their work, not replacing their actual judgment.
Exactly that. It's a tool to speed things up, but the human is still firmly in control.
Okay, that makes sense. So doctor speaks, AI transcribes and understands the language, drafts something, doctor reviews and approves. Given that workflow, what are the big benefits your sources are highlighting? What really changes for the doctors and nurses?
The number one thing, and it comes through really strongly in the sources, is just saving time. A lot of time. Reducing that administrative chunk of the day.
Talking minutes or
Hours, potentially.
hours? Really? Do they give any specifics?
They do. There was one survey mentioned in the sources looking at doctors using this kind of AI. They reported saving, on average, get this, 2 hours a day.
2 hours per day.
Yeah.
Wow.
Yeah.
That's not just a minor tweak. That's huge. That could be 2 more hours seeing patients or talking to colleagues.
Or just getting home on time for once.
Yeah. It directly tackles that burnout issue we hear so much about, doesn't it?
It seems to. Reducing that documentation slog is presented as a really big factor in, lowering stress, maybe improving job satisfaction.
Okay, so time saving is huge. Burnout reduction is linked. Does it affect the quality of the notes themselves, according to the sources?
Yes, that's another point they raise. The idea is that accuracy and completeness might actually go up.
How so?
Well, if it's easier and faster to make the note right after you've seen the patient or even during.
You remember more details.
Exactly. The note is likely to be more detailed, more reflective of what actually happened, and that helps everyone on the care team communicate better coordination.
So, potentially better notes, less time making them, happier staff. Sounds pretty good based on these sources.
That's certainly the positive picture they paint, yeah.
Now, we've talked about large language models, LLMs, quite a bit on other deep dives.
Yeah.
How do they fit into this according to what you read? Do they play a role?
They do, and they kind of take it a step further than just transcription and basic NLP.
Okay.
So based on the conversation the AI transcribed, and maybe pulling in other patient info from the EMR,
Right.
an LLM can actually help generate the clinical note structure.
Generate it, write it itself.
Not entirely from scratch, maybe, but the sources suggest they can do things like automatically summarize the key points discussed.
Okay, pull out the highlights.
Right. And they can structure the information into those standard formats doctors use, like a SOAP, note subjective, objective, assessment plan.
Ah, so it saves the doctor having to organize all the transcribed text manually into the right sections.
Exactly. It takes the raw speech, the NLP understands it, and then the LLM helps draft it into a usable, structured note.
That's pretty sophisticated.
And one source even mentioned that LLMs might potentially suggest relevant diagnoses or treatment ideas.
Whoa, really?
Yeah, based on the symptoms and findings documented, but importantly, presenting these just as prompts. Things for the doctor to consider and then validate or reject.
Okay, so it's not diagnosing, but maybe flagging possibilities based on the data. Still very much under human control.
Absolutely. It's like decision support, perhaps, adding another layer of potential efficiency using the LLM's ability to process information.
Got it. But putting these systems into, busy hospitals, different clinics, it can't be simple. There must be challenges, technical stuff to figure out.
Oh, definitely. It's not just plug and play. The sources highlight quite a few practical things.
Like what?
Well, beyond just having good AI and NLP, think about different regions. Maybe places with lots of different languages or dialects spoken in one clinic.
So the system needs to understand all of them accurately.
Exactly. Multilingual support is key in those situations. And not just the languages, but the specific medical words in those languages.
Tricky.
And then there's bandwidth. Some places might not have great internet. The system needs to work even in those low bandwidth environments. It has to be robust.
So the tech itself needs to be adaptable.
Right. And another technical bit they mention is using these pre-trained speech models, but then fine-tuning them.
Fine-tuning?
Yeah, training them specifically on the medical terms and the kinds of accents they'll actually hear in that specific hospital or region to boost accuracy.
Makes sense. You need it to understand the local context. And what about, the obvious one? Privacy, security.
Non-negotiable. The sources absolutely stress this. IPA compliance in the U.S., similar rules elsewhere. Rock-solid data security is just table stakes. You're dealing with highly sensitive patient data.
Of course. So, the tech sounds promising for saving time, cutting down the burden. But getting it right depends a lot on careful setup. Thinking about language, infrastructure, and definitely security, and that human review step.
That really seems to be the key message. It's a powerful tool, but it needs that thoughtful integration and human oversight to actually work well and safely in healthcare.
So wrapping this up then, this deep dive into your sources really shows how AI, specifically this voice-to-text automated documentation, using NLP, maybe LLMs, is offering a very practical answer to a huge headache in healthcare.
Yeah, it's not just tech for tech's sake.
Right. It's about giving back that crucial resource time.
Exactly. Time that the sources really emphasize can go back to patients, to better communication. Maybe even, as we said, fewer errors from rushed notes. It points towards a more efficient system.
Yeah, the vision coming from the sources is pretty clear, isn't it? Use AI for the admin grind. Free up the humans.
Let doctors be doctors, nurses be nurses.
So they can focus more on the actual human side of care. Empathy, clinical thinking, interaction. It feels like a step towards maybe a more efficient and more compassionate way of doing healthcare. Good for everyone involved.
It's a really concrete example of technology potentially enabling more human-centered work.
So a final thought for you, listening. Think about other ways technology might be working behind the scenes. Quietly changing how we interact with really important systems like healthcare here. What does that ongoing shift mean for the balance, between the efficiency tech brings and that human connection we still really value, especially in moments that matter?
That's a great question to ponder.
Thanks for taking this deep dive with us today.